My name is Dan Schimmel. I'm an interventional cardiologist, and I'm an associate professor in the Department of Medicine at Northwestern University. We're very excited. We started this program for chronic thromboembolic pulmonary hypertension. Our program grew starting back in 2016 with an interested surgeon, a pulmonologist, and myself. Now we're servicing people flying in from all over the United States actually to get treatment. I think there are a number of things that contribute to a program's success. One of them is we're all passionate. We are lucky enough to have two surgeons, one of them doing training beyond the typical cardiac surgery years in order to specialize in this specific procedure. It's technically quite difficult and high risk. You need people who really are going to invest in ensuring safety, training the whole team, and really want this to be a key therapy they provide. And while most pulmonary embolism is a lower risk event that just gets blood thinner, there are patients who present much sicker. We're starting to identify patients who are at more risk to develop this chronic condition from that one episode that they had. And so that's where a lot of the research right now is. Why do people develop the chronic findings of clot? How do we get them into the right testing pathway? Sometimes people just want to refer straight to balloon pulmonary angioplasty right directly to me. We want the testing of 6-minute walk tests and all of the history taking and the optimization of medications going in because it helps us stay true and show that we're having good outcomes. It helps us make sure that there are no balls dropped, that there's a very consistent care plan for those patients. And when they come in for balloon pulmonary angioplasty, we build a great relationship with them because we do see them frequently. Our patients have been so grateful for the care we've been able to provide, and that motivates us. We just recently published in Pulmonary Circulation a data set that describes our first initial experience with 100 patients that came into the program. Those who've been treated with medical therapy alone, with balloon pulmonary angioplasty plus medical therapy, and then surgery in combination with balloon pulmonary angioplasty or surgery and medicines. It's really important to put your outcomes out there in the community to be peer reviewed and be able to show that you're having great outcomes. I think all physicians, we want to provide great care. And I think based on that, our first data set, we're doing well.